Hello, I'm Eugene King, a lawyer with the Ohio Poverty Law Center. Today I'm going to talk about public health insurance programs in Ohio. If you live outside of Ohio, you should find out about programs in your state because these programs are different from state to state. Health insurance programs can be complicated, but I will focus on the most important issues and try not to get stuck in details. Health care can be very expensive. If you are eligible for public health insurance, it can free up money to pay your mortgage or other bills. That may help you stay in your home. If you think there's a chance that you may be eligible for any of these programs, you should apply for the program. That is the only way to know for sure if you are eligible. In the United States, access to health care for most people is controlled by their health insurance. Most health insurance limits how and where a patient can get health care and what services are covered by that insurance. I'm going to talk about three programs today: Medicaid, Medicare, and the Hospital Care Assurance Program, or HCAP. These programs pay for medical care for Ohioans who do not have private health insurance. Medicaid and Medicare are the two biggest public insurance programs. Unfortunately, they're often confused because their names sound so much alike. Medicaid is a health insurance program for low-income people. It is administered by the state of Ohio. Medicare is a health insurance program for the elderly and people with certain disabilities. Medicare is administered by Social Security. Some people may be eligible for both Medicaid and Medicare. So let's talk about Medicaid. In Ohio, Medicaid eligibility has different income limits for different groups. And remember, Medicaid is for low-income Ohioans. For example, in Medicaid, children are treated most generously. Children are eligible for Medicaid if their household incomes are as much as $39,000 a year for a family of three, and that's in 2013. The Medicaid income limit for parents with minor children and for Ohioans who are 65 or older, blind, or disabled are much lower. Your children may be eligible for Medicaid even if you are not eligible, so you should apply for Medicaid if you think there is a chance that anyone in your family could be eligible for Medicaid. These categories and dollar limits for Medicaid are subject to change, so if you are low income and you need health care, you should apply for Medicaid. There are other Medicaid categories, but these are the main ones. Medicaid provides comprehensive coverage for doctor visits, lab work, prescription medications, hospitalization, and other services with very few co-payments and no deductibles for covered services. Medicaid is designed to cover most of the cost of a patient's services because Medicaid understands that patients can't afford to pay for their health care. You can apply for Medicaid at your County Department of Job and Family Services. Now let's talk about Medicare. Remember, Medicare is primarily for senior citizens. Medicare is more like private insurance with co-pays and deductibles. This means that if a service is covered by Medicare, the patient will pay a co-pay amount and then usually about 20% of the cost of the services. Remember, Medicare is for people 65 and older and people with certain disabilities. There are 4 parts in Medicare, and each part has different rules and costs, and you may be eligible for one or more of these. Medicare Part A covers hospital insurance. Medicare Part B covers medical insurance, so it pays for your doctor and for lab tests. Medicare Part C is an option that allows you to join a managed care organization to receive your Medicare services. And then finally, Medicare Part D covers prescription drugs. You can apply for Medicare online at the Social Security Administration. The important thing for you to remember is that if you have health insurance, it is important to understand what that insurance covers or does not cover and what limitations might exist for you in getting care. This knowledge will help you make decisions about your health care. The Affordable Care Act and National Health Reform will change many things about health insurance, including Medicaid and Medicare. Medicaid eligibility may be expanded to include more Ohioans beginning in 2014. Beginning in 2014, in January, if you get your health insurance through the healthcare exchange or marketplace, you may also qualify for financial assistance. Individuals and families with incomes up to about $78,000 per year for a family of 3 will be able to get a subsidy or assistance from the federal government to pay for health insurance premiums. If you qualify for these subsidies, you can apply for them through the state. These subsidies could significantly reduce your monthly insurance premium costs. It is important for you to pay attention to these changes because they can affect what kind of care you can get, how you get that care, and how much that care will cost you. If you do not qualify for either Medicaid or Medicare, you may still qualify for certain low-income assistance programs. The most common program is the Hospital Care Assurance Program, or HCAP. HCAP covers the cost of hospital-level services provided to people with incomes up to about $19,500 per year for a family of 3. This does not cover all services. It won't cover a physician's billing or x-rays, but the hospital services will be covered. This could significantly reduce your hospital bills after a hospital stay. There are also other low-income assistance programs and charity programs offered by individual hospitals. If you do not have insurance and are having trouble paying your hospital bills, you should ask the hospitals for more information about these programs because they may be able to significantly reduce your costs. Finally, if you do not have health insurance, you should be aware that most medical providers bill uninsured patients at a higher rate than insured patients. This is unfair, but there are no laws preventing them from doing this in Ohio. If you are uninsured and receive a bill, you can ask your medical provider, your doctor, or your hospital to discount the bill to the insurance rate rather than the full payment level. Often, you can get physicians and hospitals to accept lower payments for the services they have provided. Getting the health care you need and paying for it can be complicated, but these programs can help you. Becoming eligible for Medicaid, Medicare, or HCAP can reduce your medical costs and free up money for your mortgage and other household expenses. This can help you to protect your home. For more information about how to apply for these programs, go to the website listed now on your screen. I hope this information helps you to understand your healthcare options. Thank you.